Thank you, Marco. So next up is Karolina from Global Health Connector. So floor is yours.
Thank you. Thank you so much, Otto, and good afternoon, everyone. My name is Karolina Mackiewicz. I'm originally from Poland. I live in Finland since 2008. And since 2020, I work for the organization called Global Health Connector, formerly ECH Alliance or European Connected Health Alliance. And what is my message here today? I would like to, and following on the colleagues from Business Finland, I would like to advocate for increased participation of the organizations from Finland in the EU-funded projects. What I see, and I work currently on the 15, together with my team at the Global Health Connector, on the 15 different projects financed by the Horizon Europe, Digital Europe, Interreg Europe, or Erasmus+. In those 15 projects, maybe I would say there are 2 organizations from Finland. One of them is, for example, Laura University of Applied Science. I don't have exact statistics, but most of the organizations that participate in those projects, lead those projects, play a key role in those projects, come from Italy, Spain, Greece, Portugal. So I really would like to encourage us all to apply for the EU funding, to take the advice from Sampo, to contact the national contact point, and to also read the available documents, available work plans for the next year. So the Sampo mentioned the Horizon Europe draft. The draft is released. We expect that the full work program will be published in December. And the first deadlines are in April. And I assume, and I already had some discussions with the organizations from Portugal, I assume that many of the organizations are already looking for the funding for the ideas, scouting the ideas, and also looking for the project partners. But we also can expect that those ideas will be more concretized somewhere in February. And I expect that when I would come to you in February, you would say, April, that's too early. So I don't know what is the solution. I would advocate maybe for more agility or courage, preparedness to come to those consortia, because this is real money. And I think that for Finland, being so north and a little bit in the corner of Europe, I would say that it's really important to play a better role. And Finnish expertise is very much valued. Every time I propose the Finnish partner to the consortium, everyone is very happy about us. Just one word about what I do and why I'm talking about this topic. So Global Health Connector, we are not research center, we are not research organization, we are a connector. We are the organization that exists to connect, convene stakeholders engaged in digital health, to amplify their message, and to accelerate the digital health transformation for health for all. And Health Capital Helsinki is one of our ecosystem, one of our partners. We work with 80 digital health ecosystems from around Europe and around the world. And yes, as we of course see also from Oulu, the ecosystem very active. We see this activity, but for some reason this activity in those networks, not only our, but also other networks, somehow does not translate into bigger participation in the EU-funded projects. I told you already about this project, so this is just a slide. If you would like to connect with me, talk about some partnerships, some support for your idea, maybe building some consortia. We have more than 1,000 partners coming from different sectors. This is mainly, as I said, digital health, so this is our scope. And as you see, we try to group our projects that we are active in into some topics like digital health and data policies, skills for health and care workforce. And as I said, it's not only about Horizon, even if Horizon is actually for the researchers the best funding opportunity, it's also very competitive. I think in some calls we see the success rate of 3%, and I understand that this might, of course, put many people like, do we really have a chance to apply for this funding? But there is also other EU for Health, for example, 80% funding rate, 60 to 80% funding rate, a deadline on 6th of January, not the particularly successful great deadline, but also the opportunity to participate in consortia. So yeah, I will stop here. Again, I encourage you all to apply for funding and to look already now into those documents that will be available by Sampo. Thank you.
Thank you.